Good morning, everyone. I'm Varsha Shrivastava from Bladder Wellness team. I hope you all are keeping safe. Please vaccinate yourself and wear a mask when in a public place. Today we are here to discuss about overactive bladder. Overactive bladder is a frequent or sudden urge to pass urine. The condition can be common and distressing and may have a huge impact in the quality of life. So, in this week, let's unite to raise awareness about the issues related to overactive bladder and its impact in the life of people living with it. To throw more light on the subject and guide us on what's right for the treatment of overactive bladder, today we have with us Dr. Omkar Joglekar sir with us. It gives me an immense pleasure to introduce Dr. Omkar Joglekar sir to you all. Sir is a senior consultant urologist from Shirur and sir have a rich experience of 7 years in the field of urology and carries out the treatment with utmost precision and efficiency, ensuring that the patient's health is in safe hands. Sir, it is a pleasure to have you in our show. We welcome you.
Yeah, thanks a lot.
So there are many things that our viewers would like to know about overactive bladder. So let's first start with the meaning of it. So what is overactive bladder?
Basically, overactive bladder is a bit complicated thing in that it's not per se, you can call it as this patient has overactive bladder. For example, if there is an X-ray diagnosis of fracture, then you can say, yeah, this is a fracture. But this is not that. It's a symptom complex which is characterized by urgency, occasionally with urge incontinence and associated with frequency of urine and nocturia. So tell you in simplified way, so if a patient is having severe desire to pass urine and it cannot be deferred, that is what we call it urgency. So this is the International Continence Society definition, which was given in 2002 by Dr. Paul Abraham sir. And definition itself clearly tells us that it's a symptom complex. So you cannot label a patient by investigation that this is overactive bladder. So a patient should be having proper symptoms which are in the form of urgency, and urgency becomes the important thing. So what is this urgency is all about? So this urgency is patient, usually a female patient gets severe desire to pass urine, which he or she cannot defer. And if it is associated with urinary incontinence, that is leakage of urine, then we call it that urge incontinence. Now, the definition also tells two important factors. That one is there should not be any underlying factors associated with it. Like this overactive bladder, though it is associated with bladder, it does not necessarily or it should not include any bladder pathology, such as stone in the bladder or any infection in the bladder. So a patient, once he or she is completely ruled out of any underlying cause, and still if the patient or the symptoms are persistent, then only we call it overactive bladder. Thank you.
Okay. So sir, who are the ones likely to get affected by overactive bladder?
So there is no specific age group or class group, but it is mostly seen in females, that too in perimenopausal period, that is from 40 to 50 years. So a patient usually will present with severe urgency with classical symptoms as I described in the definition. And on investigation, when we found out that there is no urinary tract infection, the ultrasonography is not showing any stone on or any residual urine, then we can label it as a case of overactive bladder. So female, though the population is more prevalent to have all these things, it is not that the men are completely ruled out of it. Even males can have these symptoms, but female patient in perimenopausal period is the one who get most commonly affected.
Okay. So sir, what would be the causes behind it, like that people suffer from overactive bladder frequently?
Yeah, as I told you, there is no per se underlying cause related to bladder. So just tell you in brief, it is basically two theories that have been proposed. One is a neurogenic theory and the other is myogenic theory. So the next thing would be a bit complicated, but to tell you in bladder is the storage organ which stores urine, and then it empties when patient desire to pass urine. But if there are certain mechanism, or if there is certain change in the mechanism which leads to severe urge and there is no underlying factor, then we can call it as overactive bladder. So the first is neurogenic theory, in which nerves become hypersensitive. So what does exactly mean? is that whenever we get, say for example, current, or we call it a burning sensation in the fingers. Now that mainly occurs because of excessive stimulation of nerve. So to give a simple example or a household example, if the wire of if we are planning to put on a tube light, and if it's not been properly, the earthing is not proper, then we get current. Something similar happens in this case, in which though bladder is not completely filled up, the nerves, they sense that bladder is filled up. They send the stimulus to brain, and patient feels that I need to go to pass urine. So whenever he or she goes to pass urine, there is not certain amount or sufficient amount to pass urine. So the patient only feels urgency. There is not much amount that is there, and then patient goes there, come back again after say some time. He or she feels that he should go to washroom again. So this keeps on repeating, and this what we call as frequency to pass urine and the urgency to pass urine, and this cannot be deferred. So say for example, if a person or a patient is doing some activity, and he gets severe urge to pass urine, and if he or she is not able to defer it, this happens typically in this case. The neurogen or the nerves, they keep on stimulating bladder to pass urine, that a patient needs to pass urine, but there is nothing there. So this is what the neurogenic theory is all about. And the second is myogenic theory. Now myogenic theory is what? So bladder basically is a muscular organ. So it expands and then it keeps on emptying the urine. So again, as I told you, the nerves become hypersensitive, they keep on firing. Similarly, the muscle, the capacity of the bladder, or the muscular capacity or the muscle sensation of the bladder, it diminishes, and the bladder is no longer able to store large amount of urine, and then it keeps on getting urgency and frequency. So these are the basic two theories. So to tell you in short, it is not completely related to bladder itself. It is either supratentorial, that is related to CNS complex or the brain complex, or there are multiple theories which include the A delta fibers or C fibers which are in the bladder, which lead to this theory. So all these are postulates. There is no underlying clear-cut definitive cause for this. So there is no infection, there is no stone, and there is no etiology. So we call these are the proposed theory. And to tell you in short, if there is no particular theory, then treating all this condition also becomes a bit difficult. Because there is no underlying cause to it.
Okay. So, sir, when the patients are getting such symptoms and they go to the hospital, so are there different tests which are conducted to get the surety that these might be the symptoms of overactive bladder?
Yeah, that's right. That's a good question. So that includes the definition itself is telling. So first and foremost, the basic and complete clinical examination is what is mandatory, which includes proper history taking. Any prior history taking includes what is the age of the patient, any prior symptoms of similar symptoms which have occurred in the past, any comorbidity such as diabetes, hypertension, if the patient has undergone any surgery in the past, even a catheterization for that, a urinary catheter was placed at that time. Then any neuro deficit, such as if there is history of any hemiplegia or paraplegia, any trauma to the spine that has occurred. Then a clinical examination will include proper examination of the abdomen, then nervous system. So once all this examination is done and the examination is not yielding anything, then a test, basic necessary test should be ordered. They should include first and foremost is the urine routine. So urine routine examination is a basic examination which will tell us that if there is any infection or not. If the infection is there or the urine routine shows pus cells, then one should go for urine culture and sensitivity, which will tell us the organism. Now, if the urine is definitely coming positive for infection, then overactive bladder will not be there. It is urinary tract infection which is leading to the symptoms. Now, if the urine becomes sterile or the culture is sterile, urine is not showing infection, then the next thing or next investigation that should be advised is the ultrasonography of the abdomen. Ultrasonography of the abdomen will clarify whether the bladder is having any stones, any residual urine. Now, this residual urine is important thing because incontinence, as I told you, in overactive bladder, we are only considering the urge incontinence, but there are one more type of incontinence, that is overflow incontinence. So bladder is getting excessively storing the urine, and if it is not able to empty it properly, then the urine will start overflowing from the bladder. So we should always rule out that there is no significant post-void residue. So a doctor will always prescribe that you ultrasonography of the abdomen and pelvis with post-void residue. If the post-void residue is not significant, ultrasonography is not showing any stones or any other cause of the urinary infection, urine is sterile, and the patient is having persistent symptoms, then the diagnosis of overactive bladder should come in the mind. So these are two basic things that needs to be conducted, basic test that needs to be conducted. And third most important test is the uroflowmetry. The uroflowmetry is a flowmetry test in which a patient is asked to pass urine in a machine, and the machine has a rotating disc in it, and it will calculate the flow pattern or the amount of flow and how much amount of urine is passed with how much flow it has been passed. So these three tests will tell us if there is any underlying pathology. So if all these tests are negative or normal, I would say not negative, but normal, and there is persistent symptoms, then a diagnosis of overactive bladder should be considered. Thank you.
Okay. So, sir, let's talk about the diagnosis part, about the treatment part now. So, what are the possible treatment options available? And is it possible to treat overactive bladder by giving medications, or we'll have to conduct surgery also in some cases?
Yeah. So first, I would like to tell everyone that this is not a condition in which a surgery or anything that is mandatory. So this can definitely be treated by behavioral modification, dietary changes, lifestyle modification, and once and all these things are seen and done. And if after that also patient is symptomatic, then we can go for medical management. And after medical management, there are very few cases which will require surgical intervention. So let's go by initial step-by-step approach. So initially, after taking all the history, investigation, and if your doctor has come to a diagnosis of overactive bladder, then I would suggest the patient should be counseled properly that what exactly is happening with him or her. Because this condition is very distressing. This is not an easy condition to cope up with. Like your social life, your personal life, all they become very problematic because you cannot go to a function, you cannot go outside. You always have a fear that I might be, or the patient has always having fear that he or she might leak urine anytime, anywhere. If the washroom facility is not available at public place, then it becomes very embarrassing. So counseling and proper care and talking to the patient and explaining them what exactly is happening is very important. That's what I feel is the most important part of the treatment, because everyone is, they become kind of ashamed about themselves, their own personal stature and all those things. So counsel them properly, say that this is not a condition which is untreatable. This is not a condition which is, you have to live with your life throughout. So counsel them properly. Secondly, behavioral changes and dietary changes. So if there is history of excessive caffeine or tea injection, then try to avoid them. Chart or water intake chart. This is what I feel is very important in the treatment. So what happens is that if there is excessive water intake in the late night part, say after 7 p.m. or 8 p.m. or at 10 p.m. or just before going to bed, then there will be increased urine formation and increased urination, and the patient will have to go to pass urine frequently during night time also. So this is very basic thing, that what we suggest is that don't have excessive water intake after 7 p.m. at night. That will reduce the fourth symptom of overactive bladder, which is nocturia. So what exactly is the nocturia is need to pass urine more than one time in night time. So if that will be avoided, reduce tea intake, reduce coffee intake, reduce alcohol intake, and reduce tobacco intake, if at all it is there. Reduce spicy and oily food intake, the pickles, then spices, excessive oily food, excessive fatty food, even that should be avoided. I'm not saying it should be completely stopped, but the intake should be minimal so as to just have a good amount of food. But if there is excess, try to definitely curtail it. Third, most important thing is, as I told you, keep a voiding diary. So this voiding diary is something, like in a day, what we usually tell patient is that keep a note of how much time you need to go to pass urine and how much water intake you have consumed. So, for example, starting from getting up in the morning, after the patient has passed first morning time urination, then start at 8 a.m. in the morning till 8 a.m. next day. So this 24 hours will give a doctor as well as patient information about how much amount of time he needs to pass urine, how much water intake he is having. So there is one more thing, we call it, there is a plastic container. This is a urometer. This will tell us the amount of urine that patient is passing every time he or she is going to washroom. So that tells us that, for example, if the patient has consumed 3 liters and if the frequency or the urgency is so severe that he is going to washroom but passing very small amount, then it is confirmed, and even the patient will understand that what exactly is the pathology behind it. So once we usually give this trial along with medication, as I told you, medication are definitely helpful. Now, what exactly is happening as a physiology in overactive bladder is the bladder is becoming, as the definition or the name says, is overactive. So what exactly is overactive? It is become hypersensitive. It is working in excess than what is exactly is needed for. So this excess amount of working should be curtailed. It should be stopped. It should be lessened down. Then the patient will feel better. So there are various medications. Initially, they used to be anticholinergics, but now the drug of choice is beta-3 agonist, that is mirabegron. Mirabegron is the drug of choice. So along with the behavioral changes, proper counseling, dietary modification, and starting so you can give it in divided doses or a single dose. Now, that divided doses or single dose should be depending on the patient's symptom. For example, there are some patient group which will have excessive nocturia, that is excessively need to go to pass urine at night time. Otherwise, they are comfortable in daytime. So in those patients, we can start with a nighttime dose only, and then see what is happening after say 10 or 15 days. Those patients who are having excessive daytime frequency, in them we start a dose which is in the morning with the breakfast. So these modifications need to be addressed, and initially a single medication is started and the patient is given all the treatment for a period of 15 days, and the patient is called back for follow-up after 15 days, and the next or further plan of action is decided.
Okay. So, sir, once all this medication is given, so there are always some of the other side effects also related to it. So, what are the side effects of the medication given to treat overactive bladder?
So, mirabegron is as I told you, is initially started. If there will be some group of patients who will not benefit with single bladder relaxant, in them we need to start with additional medications such as anticholinergics, which include solifenacin, darifenacin, oxybutynin. So these medications in combination or separately, they can be started till the patient gets good relief. So once the patient gets good relief, we should curtail down to single dose medication or single strength medication. Now, as you asked, there are definite side effects. Basically, anticholinergics such as solifenacin or darifenacin, they are having more side effect in the form of dryness of mouth, constipation, nausea, and blurring of vision. But as I told you, the mirabegron or the beta-3 agonist has become a drug of choice, and it is we can definitely say it was launched say about most of the patients will benefit with this single medicine.
Okay. And sir, suppose that you have told that after 15 days, we'll see whether the changes are there or not. Suppose if after 15 days also, the patient is not able to recover. So what can be the another method to treat it?
Yeah. So as I told you, initially I usually prescribe single medication only. Then if the patient is still not having relief, then we go for a second dose in the form of anticholinergics. Again, wait, again, see what is the response. Usually 90 to 95% of the patients will definitely have good response with combination medication. But if, as I told you, certain group of patients, if they are not having any say response, then we might need certain specific additional investigations. Now, these additional investigations include urodynamics as a first line investigation. Now, what exactly is urodynamics all about? So, urodynamics is a dynamic study of the urinary bladder, which will tell us what is exactly happening with the bladder when it is getting filled up and when it is getting emptied. So the urodynamics will definitely help us in coming to a diagnosis that it is only overactive bladder and nothing else. And if it is not overactive bladder, and then that is the reason the patient is not responding, then urodynamic will definitely inform and let us know, and then we might need to do further tests in the form of MRI of the spine or the MRI of the pelvis. But these tests and the urodynamics also, for that matter, is not needed in many patients. There are very few select group of patients which will need this. Otherwise, it is the symptom complex and classical examination, history taking will definitely clinch the diagnosis.
Okay. And sir, as you mentioned that to check the patient's history is also very essential. So in that, do we consider that this problem is possible because of some genes or some genetic factor can also be involved in it?
It's not completely proven as of now, but there are certain theories which have been proposed. But as I said, it is not mandatory thing that patients, say parents are having this problem, the patient will definitely get it, or the parents are not having, patient, not exactly the parents, any relative is not having any problem, and still patient is getting the problem. So it's not completely that a person is completely immune if the parents are not having this problem, or the patient will always suffer if the parents are having this problem. So this neurogenic as well as the myogenic theory is what is more important than genetic theory.
Okay. And sir, apart from this medication, and as you have told that we can have some lifestyle modification as well. So what is the role of the exercise or the meditation that the patient can do?
So that's a really good question, because this, as I told you, patient becomes very anxious, and this is very common to understand, that the patient becomes, the condition itself is very embarrassing, anxious, the anxiety levels are very high. And the very simple example that I always tell patient, that if we are going to face any interview or there is an exam, then we always feel the urge to pass urine. It is very common condition that many, like even patient or the students also experience that. Say for example, there is tomorrow exam, then day before that they will feel to go to pass urine frequently. So that itself tell. So the frequent or the important line in our textbook is that the urinary bladder is an organ which is autonomic organ but under voluntary control. So to tell you in brief is that we can definitely control when to pass urine and when not to pass urine. So this control, though the bladder is filled, we get severe desire to pass urine. The patient will always feel the desire, but the patient will not pass urine, or any person will not pass urine unless and until the brain or the nervous system instruct him to do so. That's why the neurogenic theory has come into the picture. So this meditation will definitely help. Meditation will keep the patient relaxed. The excessive firing of the nerves that is occurring from the brain will definitely be reduced. But as I told you, this is one of the treatment option. This is not the treatment option. So meditation, exercises will definitely divert mind, calm the mind, reduce the anxiety, and help us in decreasing the neurogenic firing. So that definitely helps. And this exercise, and there is one more type of exercise, as I said, the pelvic floor exercises, as everyone know commonly. So this will help in reducing the urge, and this will help in increasing the bladder capacity. So there are pelvic floor exercises which will reflexively help in relaxing the bladder, which will reflexively control the urge, and this will also definitely improve. So not only the exercises in the form of, say, walking, cycling, swimming, but these pelvic floor exercises also are very helpful.
Okay. And so it happens that the patient who suffers from overactive bladder, they think that it is because of drinking too much of water. Or if they will drink water, then they'll have to hurry to pass urine. So they stop the intake of water, or just cut the intake of water, or you can say that they don't drink water that much. So still, how much liters of water is still considered essential that the patient should take?
This is a common fear that lead a patient to not to drink water, because this urgency and urge incontinence can occur at any time, and the patient will not go to any place. If he or she has to go to his workplace, then he or she will see to it that the water intake is less prior to going to office or something of this sort. But I would say 2 liters of water intake is what is sufficient and what is must. Not sufficient, it is mandatory. Above 2 liters, a patient can vary depending on the seasonal conditions, say summertime or winter time. But at the same time, I would like to suggest is that these patients should have water intake which is frequent, small water intake. So it should not happen that suddenly you get up in the morning, have 1 liter of water and then nothing in entire day, and then again 1 liter at night. This should not happen. So have frequent small amounts of water frequently, so that the bladder will not be filled up immediately. The patient will not get any urge to pass urine. So keep the quantity to adequate amount, but have this quantity divided in small doses, so that the amount is also reached and the frequency is also reduced.
Okay. And sir, let's take some questions that we have got from our live viewers. And the first one is from Shubham Maran. And he's asking, sir, are there any dietary habits which help in preventing overactive bladder? Suppose we have not got overactive bladder, so what can we do to protect ourselves?
See, there is no diet that has been said to prevent overactive bladder. Overactive bladder is, you can avoid only when, you can decrease the severity of it after with dietary modification. But if there is excessive coffee or caffeine intake, if there is smoking, if there is alcohol consumption, obviously this will definitely, the stoppage of it will definitely, I won't say prevent overactive bladder, but definitely it will reduce the chances of developing overactive bladder. Also, if there is excessive oil or spice intake, also will reduce it. But as I told you, this will help in decreasing the severity of overactive bladder once it has occurred. It has not been shown to prevent overactive bladder. Okay. But always stopping alcohol intake and tobacco intake will definitely help in other health issues also. So that is always helpful.
Okay. Sir, let's take another question, and it's from Gitika Sharma. And she is asking, sir, how soon can I expect my symptoms to improve?
With proper medications, you should get relief in at least 3 to 4 weeks. If there is no, and the improvement will be good, and the significant improvement will be there. There will be decrease in incontinence. There will be decrease in urgency. The frequency part of it will take some time to reduce, but at least within 4 weeks, you should get good relief. At least 90% of the relief should be there in 4 weeks with proper medication, behavioral changes, exercises, meditation, and dietary changes.
So at least for 4 weeks, or we can say a month, you'll have to wait. And
no, not exactly. Yeah, sorry to interrupt you. Not exactly. You will have to wait for 1 month. Basically it depends on individual variations are always there. Some people get relief within 3 or 4 days also. Some people get relief for 4 weeks. So the average that we consider is 3 to 4 weeks. Within that period, you should get good relief. That's what I said. It is not that you will have to wait for 4 weeks, then only you will start getting relief. It's not like that. Some people might get relief in 1 week also.
Okay.
So I have seen patients who come to me after 15 days and say, I'm completely fine. I'm not having any complaint. Even that has happened. And I have seen patients who come to me after, say, 4 weeks and said that there is no relief. Then I need to add medications and all those things.
Okay. So from this, we come to another question. And that is from Ankit Chaurasia. And he's asking, sir, if my overactive bladder gets better, so can I stop taking the medication?
Yeah. So once the complete relief is there, which is documented by the patient history and the symptom relief, then the medications are stopped they are not stopped completely immediately. They are tapered down doses are there. And obviously the patient can stop medication. And then we usually see what is happening. Like after stoppage of medication, what I usually do is that I call the patient after, say, period of 6 weeks, that is 1.5 months, and see what has happened exactly in this 1.5 months. But at the same time, I always give them proper advice regarding the behavioral changes, the dietary changes, and exercise. They should be continued so as to not to have similar symptoms again. And after, say, 1.5 months, without medication, if the patient is getting complete relief, then there is no need of taking or continuing medications. So that definitely the medication can be stopped. It is not mandatory that the patient needs to continue the medication lifelong.
Definitely. And the next question, sir, we were discussing about the smoking and alcohol habits. So similar question we got over here, and this is from Tanuj Yadav, and he's asking, sir, does smoking has anything to do with the overactive bladder?
Yeah, smoking increases the severity of the overactive bladder, because the nicotine has found to be basically all the dietary changes that I suggested are to decrease the excess bladder stimulation that is happening. So nicotine has found to irritate or stimulate the bladder excessively. So that's why the smoking is advised. Alcohol, as everyone knows, alcohol increases the frequency of urine on its own only. And the caffeine increases. So caffeine, nicotine, and alcohol, these are bladder irritants that we call. So once you reduce them, the bladder becomes less irritable and the overactive bladder symptoms reduce. So before giving this definition of overactive bladder, the bladder or this symptom complex used to be called as irritable or hyperactive bladder. So that's what the underlying factor is. Nicotine, caffeine irritate the bladder. So stop them, the bladder is become less irritable and the symptoms will reduce. That's what the pathology is.
And sir, as you mentioned, that caffeine intake also is one of the factors. So people who drink too much coffee, or we can say tea as well, especially in India, people, they drink too much amount of tea. So still, how many cups of tea or coffee can be considered as normal and they can take it in a day?
See, there is no normalcy definition that has been given, but I would suggest I have seen patients who are consuming 6 or 8 cups of tea or coffee per day. I usually tell them it is very difficult to stop immediately, that not to have tea at all, because they become so used to having a lot amount of tea. I would suggest only 1 or 2 cups of tea, if at all they are not able to stop it completely. But if they are able to stop it completely, then that's the best thing. But there is no definition saying, see, 1 cup of tea is acceptable, 2 cups of tea is acceptable. It's not like that.
And sir, it happens that in most of the diseases, especially in overactive bladder or urinary incontinence, people, they don't take the proper treatment as a thing that it will go on its own. So what happens if the patient is not taking the treatment of overactive bladder at all?
Yeah, fine. So there is one part of the treatment that was remaining when we were discussing the treatment, that is the surgical management. But before coming to the surgical management, if the patient is not taking the treatment at all, because in especially our country, everyone feels that this is a part of the aging process and they will not take any treatment. Or what will happen is that, as I told you, there are some patients who will get relief in a period of week. So they will not come back for follow-up, and then they will say, fine, there is a reduction, and then they are happy with it. This is not the case. See, it is not going to cause any major these things. They are not good if they are not treated. There will be repeated infection, there will be repeated soakage, and the leaking urine continuously will lead to decreased bladder capacity. And say, for example, after a certain period, the frequency will be so severe that doing a day-to-day life will also be very difficult. So mainly repeated urinary tract infection, repeated damage, or repeatedly not able to perform the day-to-day activity are the two main things that is there. That was the main changes the lifestyle also, and becomes very difficult to perform your activity. So it should be treated at the earliest.
That is the main thing that everyone should keep in mind, as in when you're finding any kind of symptoms, must take the proper treatment, and then you can expect to see the result. It's all about having patience. Okay. And so as you were mentioning about maintaining a bladder diary as well. So could you please elaborate about what is bladder diary and how can the patient maintain it?
So it is, see, the bladder diary is mainly just to document what exactly the symptom complex is. See, for example, what happens, there are mainly in children, that they have a very large amount of water intake and then they pass urine frequently. So what this diary is helpful is that in the form that it is very easy to maintain. It's a single page, a piece of paper. You should write at what time in a day. As I told you, 8 a.m. from day 1 to 8 a.m. to day 2. So how many times the patient has gone to pass urine, and what is the amount of urine that he or she has passed, and how much is the water intake she has consumed. So these 3 things will compromise the bladder diary. They will help us the amount of urine, the frequency, and amount of water intake. So amount of water intake is very high and the amount of urine that has passed is very high, then this is acceptable. So that does not necessarily mean it is overactive bladder. What exactly is that the patient is having large amount of water and he or she needs to pass urine urgently, and he or she passes very small amount of urine, then that what considers or that should raise the suspicion of the overactive bladder. It is not for treatment, it is to confirm the diagnosis of overactive bladder. That's what the bladder diary is given for. And as I told you, the surgical management, even that needs to be mentioned here. The surgical management includes sacral neuromodulation, tibial neuromodulation, and the Botox installation. So all these things, as I told, what exactly is happening in sacral nerve modulation is that the sacral nerve is what is supplies the urinary bladder. And if you are doing neuromodulation for this, then the excessive firing that is occurring through this nerve will be reduced, the bladder capacity will be increased. What a clinician is in need for is to increase the bladder capacity so that the frequency is reduced, the urgency is reduced. Similarly, the Botox, that is the botulinum toxoid injection, which is taken from the bacteria Clostridium botulini, it will help. It is a muscle relaxant, and it will help in relaxing the bladder muscle and increase the bladder capacity. All these things, they are only to increase the bladder capacity, but these are not the permanent therapies. The botulinum toxoid treatment will need to be repeated after a period of 1 to 1.5 years. Even the neuromodulation might not be helping. The sacral nerve stimulation will not be helping much. But these are the theories, or these are the surgeries that have been proposed. In some patients which are intractable or which do not respond at all to any sort of medication, they may be helpful.
Okay. So, sir, once the surgery is done, so post-surgery, what are the things that the patient should keep in his mind so that he is not suffering from any other problem in future?
See, basically, all these things, they relax the bladder, they increase the capacity of the bladder. So patient should see to it that the bladder is getting emptied frequently. Sometimes what happens is that the bladder gets relaxed so much and the patient feels so comfortable that he or she does not go to pass urine at all. So this should not happen. This will lead to increase in the storage of the urine. Again, this will lead to increased urinary infection. This might put pressure on kidneys also. So these things should be reported. A follow-up is always must. Ultrasonography will definitely be helpful, and a follow-up with urologist is what is always needed for.
And sir, once the surgery is done, after how many days the patient can get back to his normal life and start doing the normal routine work or the physical activity?
See, these are endoscopic surgeries. There is no, the hospital admission is not for more than 48 hours. And even he or she can resume the duties, say, in a period of 1 week also. He or she need not be bedridden or should not be taking bed rest. It is not needed. All these things will be informed by urologist prior to surgery, and what exactly needs to be done, what care should be taken. All these things are always informed. As I told, all these diseases, they need proper counseling. They just don't need medication and advice. They need counseling, talking to patient properly, giving them time, and that will definitely help in reducing the symptoms.
Definitely. And sir, what are the chances for this problem to reoccur once the treatment is done via medication or via surgery? So are the chances there for overactive bladder to reoccur?
Yeah, this can definitely reoccur in males as well as in females, both. As I told, that the nerve fibers that are getting excessively stimulated, even that can happen again. So it is not that this disease is there for only for a period. There are certain seasonal variation that patient may experience. There are certain, mainly in summer season, that patient might get. There are certain patients who come to during every summer season, they get overactive bladder, they get treated, the entire year goes very well. Again, next summer season. So it is not that patient who has got overactive bladder treated for it will never get it. Patient should be aware of all these things. He should be keeping the dietary changes, behavioral changes, exercises, as well as water intake in good amount so as to avoid it from reoccurring.
Sir, pregnant women also face some of the other symptoms of this overactive bladder. So what can they do, or what kind of treatment can they take?
In pregnancy, it is not overactive bladder. It is mainly because of excessive progesterone that is stimulated during the pregnancy. Also, the increasing size of gravid uterus, it keeps on pushing the bladder, and then they lead to increased urinary frequency. All the medication that we mentioned for overactive bladder, they cannot be given during pregnancy because they have not been proven to be pregnancy safe. So only the behavior, if at all, as I told you, in pregnancy, all these symptoms, they occur mainly because of the urinary tract infection. or they could be because of stones also, because the progesterone, it relaxes the bladder, the ureter, the urine drainage is not complete. So these infections are pretty common. So once you have documented that there is no infection or stone, then only the behavioral modification can help, but the medications cannot be given at least till the delivery.
Definitely. And so as you mentioned that the patient who's suffering from overactive bladder, they have to go through a lot of emotional stress as well. So what can they do so they don't have to be so much stressed out and they can be a little bit easy on themselves?
Yeah, that's it. As I said, the urologist or the physician needs to counsel them properly. Basically, it becomes very social stigma that if the urine is continuously leaking, so the counseling is important. Talk to your physician, your urologist, get your all the doubts solved. What happens is, this is not age, though it is age related problem. It is not that the patient will have to live with it. It can definitely be solved. Get assurance about it. As your program is saying, get information about it, and it will definitely be helpful. Talk to your colleagues, talk to your friends, get or indulge yourself in some activities, and then it will be helpful.
Okay.
Basically, try to reduce the anxiety, because the more the anxiety, the more the symptoms. The anxiety is not going to help patient to reduce the symptoms. It will increase the symptoms.
Yes, definitely. So, sir, in the end, what are the possible suggestions that we can give to the patients or the live viewers who are watching our session? What can they do so that they don't have to suffer from overactive bladder, or even if they are suffering from it, so they can do something for themselves?
So basically, have good exercise, have good amount of food intake, have healthy food consumption, do exercises. Then when the patient or anyone does not need to go to gym to have good exercise, have good amount of walk, cycling, running. Even they are really good exercises that will help keep your mind as well as body fresh. What I always feel as, the healthy body is always in a healthy mind. So your mind should be healthy, then your body will always remain healthy. Have good food. Try to avoid spicy food, heavy, spicy, oily foods. Avoid any bad habits such as alcohol consumption, smoking. And if you are having if all these symptoms are there, if you are suffering from overactive bladder, do not hesitate. Meet urologists, talk to them, get your doubts solved, get proper counseling, reduce your anxiety, and that will definitely help.
Definitely, sir. So once again, thank you so much for such an informative session. It was indeed very much informative for all our viewers. They got to know about overactive bladder, the causes, the treatment, and all the other important relevant factors involved with it. So thank you so much for your valuable time, sir.
Thank you. Thanks a lot, ma'am. Thanks a lot.
And thank you to all our viewers for being so patient and asking all the questions related to overactive bladder. We'll see you all soon in the next session. Till then, you can follow us on our FB page. You will find us by the name of Bladder Wellness. You can also follow us on YouTube, Twitter, and Instagram by the same name. This is your host, Varsha Srivastav, signing off. Take care, everyone. And thank you so much, sir, once again.
Thank you. Thanks a lot.